In this morning's Health Watch, a promising cancer drug for women. It's now being tested on patients who have a genetic condition that makes breast and ovarian cancers more common.
Doctors say the drug doesn't have the side effects of chemotherapy. Bill Whitaker has more now with the story of one patient who has had a stunning turnaround.
So how are you?
I'm doing good, doing great.
These days, Tina Rourke describes herself as a cancer survivor.
This time last year, I wouldn't have ever thought I would be sitting here today.
Tina has been battling breast cancer since 1999. She was just 37.
My son was in the first grade, and he graduated this year. And I did not think I was going to get to see it.
Surgery and grueling chemotherapy led to remission, but 5 years later, the cancer came back with a vengeance.
I had a lot in my spine and my bones and my back.
Come on and follow me.
Okay.
Tina is one of the 5 to 10% of women with breast or ovarian cancer who carry mutations of the BRCA gene. The BRCA1 and 2 genes actually are tumor suppressors, so a damaged gene puts a woman at high risk for the disease. Not only did Tina test positive for the mutation, so did nearly every woman in her family. Cancer struck 9 relatives over 4 generations.
Did you think you were going to die?
Yes, I was prepared to die. My life was not worth living because it was just constant pain and agony and doctors.
When chemotherapy was no longer working, Tina's doctor learned of a drug trial at Cedars-Sinai Medical Center in Los Angeles for end-stage cancer patients genetically predisposed to the disease. It is giving hope to the hopeless.
Say ah.
In March, Tina joined the study under the direction of Dr. William Audie.
So that's the miraculous pill.
Yes.
Tina takes 16 pills of olaparib a day. Here's how the drug works. Throughout the body, cells are constantly replicating and repairing themselves. Cancer cells replicate so fast that mistakes occur, causing DNA damage. Olaparib targets only the cancer cells and blocks the enzyme they need to repair their DNA. The result, the cancer cells die. In this international trial of about 300 patients, 30 to 40% are responding.
It's very difficult to say cure with anybody who has advanced cancer.
But remarkably, in the past 9 months, Tina's tumors have shrunk 64%.
Well, it's always amazing to see a drug that really doesn't have a lot of side effects produce responses in people who have very advanced cancers.
Tina travels from Arkansas every month and nervously awaits test results.
Everything's stable. It's very hard to find any sign of cancer on your scans any longer, and there's certainly no sign of it in your blood. So
wow.
We will just keep going.
All right, that sounds good. It's amazing. Every day is wonderful. It's a godsend. It's a blessing.
And she's now looking forward to her son's next milestone.
So what was that like to see him graduate?
It was a beautiful day. It was a beautiful day. Now I'm going to wait and see him graduate college. I'm going to see him walk across that stage.
Sometime next year, about 100 more patients will be accepted into the trial. Bill Whitaker, CBS News, Los Angeles.
Now, researchers say the future of cancer treatment really lies in targeted therapy like this one. They also point out the study has not determined still how long the drug will be effective in any one patient.